Welcome back. Some new guidance from the American Academy of Pediatrics says infants and young children should get COVID-19 vaccines, but that guidance for the first time in 30 years greatly differs from what the CDC is advising. The CDC's immunization committee was recently overhauled, you might remember, by Health and Human Services Secretary Robert F. Kennedy Jr. And the pediatric group says it was replaced with members who have spread vaccine misinformation. The CDC says COVID shots for children 6 months up to 17 years old should be based on shared clinical decision making, and they do not recommend shots for healthy children and healthy teenagers. But the AAP, that group that I mentioned, recommends all children ages 6 months up to 2 years be vaccinated, and that a single dose is appropriate for some kids ages 2 through 18. Well, if it feels like COVID-19 is everywhere again, you may not be imagining this. The CDC says cases are on the rise across the country, and Texas is among the states leading the nation. Meredith Yemens reports on this summer COVID wave.
With summer travel winding down, there's a new wave of COVID-19 just in time for school.
As kids go back to school, we're going to have to be very careful because COVID-19 will begin to spread.
The CDC estimates infections are growing in 24 states, including Texas, which has a positivity rate of nearly 12% compared to the national average of 8.9%. It says emergency visits for COVID are also up among people of all ages, with a noticeable increase in children under 12, though the CDC says the percentage remains low. Stephen Love is president of the DFW Hospital Council.
I don't want people to panic. It's not the pandemic, but, COVID-19 is going to be endemic. It's going to come back, and we're going to see it from now on.
Love says the current wave is fueled by summer travel, low vaccination rates in Texas, and the newer Stratus variant.
But I think with Stratus, it's since it's a variant and has mutated from the original, that it's going to be much more contagious.
Symptoms include sore throat, cough, fever, and headache. And while the wastewater viral activity level for COVID nationally remains low, the CDC says in Texas it's very high as COVID makes a comeback yet again.
Well, the CDC still says that hand washing, wearing a mask, and avoiding contact with someone who's infected are all still the best ways to prevent the spread of COVID.